Let's look at just one more supposedly pro-mask study, the Massachusetts General Brigham Hospital System Facemask study. This study was officially published in August, but it was available online before that, and I personally read it in July. It has been widely cited as being good evidence for the efficacy of universal masking. Seriously, just go Google Massachusetts General Brigham Face Mask Study to see what I'm talking about. The authors have said, quote, "We believe that our study provides definitive data on the value of universal masking in a healthcare setting during a pandemic, and that the results can be generalized to other settings even where social distancing is not possible." I actually agree that the results can be generalized to other settings. I just happen to think their results actually show the opposite of what they're claiming. I happen to believe that their results show that universal masking has no value. And I'll explain why. Quote, "The study assessed the association of hospital masking policies with the SARS-CoV-2 infection rate among healthcare workers," close quote. What the researchers did was to track the SARS-CoV-2 test positivity rate among healthcare workers in the Massachusetts General Brigham Hospital system from March 1st to April 30th of 2020 and look to see how those positivity rates varied when overlaid onto a timeline of masking interventions. Universal masking was mandated for all hospital workers within the Massachusetts General Brigham Hospital system on March 25th and for all patients on April 6th. So the study defined the intervention period as being from April 11th to April 30th. During the intervention period, the positivity rate decreased linearly from 14.65% to 11.46%. So the authors concluded that, quote, "universal masking at Massachusetts General Brigham was associated with a significantly lower rate of SARS-CoV-2 positivity among healthcare workers," and that, quote, "these results support universal masking as part of a multi-pronged infection reduction strategy in healthcare settings," close quote. Now, the study did do a number of things really well. For example, it excluded all duplicate positives from the final test results. But when examined closely, it does not provide evidence which supports the idea that universal masking works. Because Massachusetts itself, as a state, didn't have a general public mask mandate from the governor until May 6th, the Massachusetts General Brigham study results could have easily either been falsified or strengthened prior to publication if the authors had just compared their hospital population test results to those obtained from the general population of Massachusetts over the same time period. And we know that they had this data available because they reference Massachusetts April 30th and May 31st COVID dashboard documents in the comments section of their article on the JAMA website. Massachusetts makes the data underlying those dashboard documents available and relatively easy to find. Remember, the purpose of the Massachusetts General Brigham Face Mask Study was to try to assess the effect of universal masking on the SARS-CoV-2 infection rate. In other words, they were trying to see whether face masking actually has an effect on the epidemic curve. So let's see what happens when we carefully extract the data points from the chart of the Massachusetts General Brigham Face Masking Study and then put those data points and the ones from the Massachusetts general public on the same graph. What we see is two epidemic curves that follow an identical course. They even peak on the exact same day, April 13th. Now, the study authors point out that during their intervention period, test positivity rates declined by 3.19%. To get this, they used their data points from April 11th and April 28th, subtracting the data point on April 28th from April 11th. But when you use the general public's test positivity rate, according to these same criteria, you get a decline of not just 3%, but 12%, from 29% to 17%. By the study author's own criteria, the general public, which did not have mandatory universal masking, experienced a greater decline in test positivity rates over the same time period. Just for fun, because we can, let's graph out the rest of the data underlying Massachusetts' May 31st COVID dashboard. When we do that, the smooth epidemic curve gets even easier to see, and it becomes obvious that Massachusetts Governor Baker's later masking order, effective on May 6th, had no effect on the epidemic curve either. Now, the obvious objection here is that we see consistently higher positivity rates for the general public than we do for healthcare workers, but this does not falsify my analysis. You could argue that the observed difference in test positivity rates between the healthcare workers and the general public comes from the benefits of personal protective equipment and the healthcare workers' more skilled use of them, and that is possible, but there are at least two major reasons we should expect to observe a higher positivity rate in the general population. First, the general population had double counting of cases. The Massachusetts General Brigham study authors eliminated duplicate positives on the same person, but the Massachusetts Health Department didn't do this. Second, we should expect the general population to have a higher positivity rate because the general population had a higher selection bias in favor of positive test results. The hospital system had the resources to test a proportionately larger number of suspected cases among their employees than the state as a whole was able to, so fewer of the less symptomatic cases among the general population actually tested relative to the total number of tests administered, which would produce a higher overall positivity rate. Regardless, far from being evidence in favor of universal masking, the Massachusetts General Brigham Hospital study, when placed in the proper context with additional data, actually suggests that masks didn't change the inevitable epidemic peak and downturn in the slightest. You know you have a strong case when even the opposition witness agrees with you under cross-examination, and when closely examined, when more information is provided, these pro-masking studies change sides faster than Benedict Arnold.